So my name is Deinniol Owens. I'm one of the national investigators at the Healthcare Safety Investigation Branch. I'm currently acting into a position as one of the principal national investigators, and I've previously completed secondments as one of our senior investigation science educators. So normal day is investigating patient safety risks that have the potential to impact on patients and staff across the NHS in England in multiple different care settings. So typically that'll be leading on investigations into lots of different areas of care. We could be looking at stuff in acute hospitals, we could be looking at mental health, GP practices, we can look at community care. It's juggling each of those areas around, speaking to staff, speaking to patients, analysing evidence, writing reports, and engaging with particularly national stakeholders to try and understand what their role is, and particularly where our recommendations can help improve the national picture. So my journey into patient safety probably started at quite a young age. So my family are all nurses by background, mum, grandparents, great-grandparents, and always thought I wanted to go into the NHS. And then I took a look at science A-levels for medicine and thought, not doing science A-levels, and completely diverged. And I went off and did law. And I became a commercial solicitor in an international firm, but didn't really find it very rewarding. I was pulled back towards healthcare and wanting to get back in that sector. So I started work at the Health Service Ombudsman, and very much on an individual basis, looking at complaints by individuals to see if care was appropriate and people were getting the answers they needed around the care they'd received or the care the loved ones had received. And that really sparked my interest in understanding, trying to improve care for people and trying to understand how we do that. So from there, I went to the front line. I worked in NHS Trust, again, doing that more complaint governance-y role. That was very individual, how we deal with things. Maybe a directorate would improve as a result of one of our complaints, but I wanted to have a greater impact. So from there, I went to the CQC, and that took me up the next level. I could make an impact across a hospital via inspection and regulation. Then I became an inspection manager, so I had the chance to impact across a region and to improve safety across regions. And then finally, now at HSIB, we operate nationally. So again, it's that national approach that we can take. And it all goes back to me, to that drive of how do we make things better for people, and people being patients, families, and staff as well, so that everyone gets the best experience they can in receiving and delivering healthcare in the NHS. So there's a few aspects of the role that I find really fulfilling. I think primarily the opportunity to actually engage with people at the front line, doing the work to understand what's happening, the challenges they're facing, and very much, particularly recently, the pressures that they're under. Because I think we have to understand that as the basis of safety. The safety we can offer patients doesn't exist in a perfect world. It exists in the context of how we're operating at the time. And getting that insight really helps to build that picture of what needs to happen, and particularly where the boundaries are of what we can improve at certain points. And that stretches to the families as well, and patients, actually engaging with patients around their experiences, understanding that different perspective that sometimes I think we can lose if we're just taking that professional view. There are many different views of how the system works, and actually gathering all those together is really fulfilling because you start to see the full picture, you start to get the story. I think the other particularly fulfilling thing is the ability to engage with national stakeholders. And we're in a very lucky position at HSIB where our engagement is with very senior figures in the NHS, Department of Health, Royal Colleges, regulators, because we have that line to try and influence that change. And having those discussions, it's quite privileged really to be able to talk to people in those positions, to share our reports, to share our findings, and to try and persuade people to do things that we think can improve safety. It's just really fulfilling when you see that accepted and you can start to see things trickling down into the system to make improvements. One of the biggest challenges we face in HSIB, or certainly have faced today, is how our existence operates. So we operate under ministerial directions from the Department of Health and Social Care. The anticipation has always been that we would be a statutory independent arm's length body. There's been some delays in that happening because of lots of reasons, including things like Brexit and obviously COVID having an impact on things. We are in the health and care bill, so we hope to be independent by 2023. But day to day, that can be quite challenging because we are established as an independent safety investigation body in the way they exist in other industries like rail or air or marine. But we still have to have conversations around the fact that we exist within an HSEI, and we are functionally independent, but we are reliant on that structure of how we operate in the sense of pay, HR structures, essentially paying rations is how we describe it a lot of the time. But that means it's a challenging conversation to get buy into an independent approach when you're seen to be part of the system sometimes. And we've, I think, grown our ability to have those conversations and the confidence people have in our reports and what we put out, but it's still quite challenging without that independent footing. It can impact on the public's perception sometimes. I think we're quite lucky that once we're able to engage with patients and families and explain what we do, and they can see our approach and they can see the results of what we do, I think those concerns fall away, but it's getting through the door and being able to engage people up front. And I think as far as the system goes, it's a new concept for healthcare. It's something that, as an investigation body, we were the first to be established in the world, I think. There's very, very few out there globally. So it's a new concept for lots of people in any healthcare organization. When we knock at the door and say, we'd like to investigate from this perspective, the independence, I think, will help because it gives us something to point to in more detail and say, this is our role, our responsibility, this is what we do. I think while we're perceived as part of the existing healthcare structures, people have baggage around how they've engaged with people previously that they can bring over. And we do operate quite differently. And again, once we engage and people see that approach, it works out fine and people see we're different. It's just, again, getting through that door and building that confidence early doors. In regard to what the next few years hold for patient safety, I think what I'd like to see is an increase in professionalisation of what we mean by patient safety in the NHS. And there's a growing movement behind that. We've got the NHSCI work around the patient safety strategy. We've got the Academy of Medical Royal College work. We've got HSIB's own training programs around investigation science and the Chartered Institute of Ergonomics and Human Factors as well, looking at their healthcare pathway. And it is just trying to embed that professionalized approach because it is really complicated in healthcare. Safety is a professional role. There's lots to know, there's lots to do. And I think the more we can incorporate that into an MDT structure in organizations where it's got equal voice to things like law, accountancy, engineering, or those other professions, I think the better we'll be at being able to integrate safety across the system and take an approach that will really make improvements for staff and patients. So thinking about one thing that we could do to improve safety, I find it really hard because it is so complicated. Healthcare as a system is so complex and there's so much going on. And I think quite often we search for that magic bullet that'll fix something and it's just not there. And sometimes that's really hard to accept it's not there. And it's hard to just go, you know what, it is really complicated and it's hard to make changes that are actually effective. And I think the biggest change for me would be that maybe more of a rational conversation around just how complicated things are and that things are hard. And maybe some things aren't an easy fix and it's not possible to solve by a simple process or by a new piece of equipment. It's more fundamental. And I think the more we're able to have those conversations where we're honest about that complexity and the limits of what we can do and what we can't do, I think the safer we get because we operate in a space then of knowing what our risks are, knowing what our hazards are, and proactively starting to manage them rather than sometimes them just creeping up on us because we don't have those conversations. Hobbies and interests outside of work, I think they do have an impact on how I think about things. So for context, my wife's a veterinary nurse, so I know lots of vets. And as a result, we have many, 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 many animals. I can't stress how many animals we have. 5 dogs, 9 guinea pigs, 8 chickens. There's usually a baby hedgehog somewhere being nursed. But the impact that's had is actually seeing and making comparisons across industries. So actually some of the challenges that the veterinary profession face are quite similar to what we have in the NHS, and they have different approaches you learn from. And actually that goes to, albeit not outside of work, I'm lucky to work with colleagues from lots of different industries with lots of different professional backgrounds. And actually that has the biggest impact on me, because it's about taking the learning we can, applying it to healthcare, realizing that sometimes you can't just drag and drop. It doesn't work like that, but we can learn from lots of different approaches. And say certainly outside of work, I've had some very interesting conversation with vets, with military personnel, with nuclear personnel, with people that work in shipping, about all the different things that people do to think about and approach safety differently in those industries. And actually what you can pull from like a common threads that you start to bring to your work, and you start thinking maybe not in a specific healthcare way, but a broader way about safety and how we apply some more broad principles across lots of different areas. I was lucky enough to go to university with some very good friends, but someone that was at university um, was the Crown Prince of Luxembourg. Um, he was only there for a short while, but I'm pretty certain me and my friends taught him the last ketchup dance. If anyone can remember that, Google it.